Since 1948, the American Academy of Neurology has been promoting the highest quality patient-centered care. And with more than 40,000 members strong, the organization is dedicated to enhancing member career satisfaction. And what better place to network and engage with fellow physicians, researchers, and members of the global neurologic community than from the 75th anniversary meeting. From the beautiful city of Boston, this is the AAN Annual Meeting, and this is AAN-TV. All week long, we will be bringing you in-depth sit-down interviews with the decision makers, award winners, and trailblazers, bringing new research and innovation to neurologic care. We will also take you all around the nation as we highlight the organizations and institutions at the forefront of groundbreaking new treatments and care to the field of neurology. There is so much to see, and we want to make sure you never miss a minute. You can always find the latest AAN-TV episode airing on the TV station throughout the Convention Center, on the AAN website, on the in-house channels at all of our partner hotels, and on the AAN YouTube and Twitter channels. Our focus today is celebrating 75 years of accomplishments and achievements of the AAN, and we kick things off on this exciting first day with someone who has been a leader within the Academy for 20 years and for the past 2 has served as AAN President, Dr. Orly Avitzur. Dr. Avitzur, thank you so much for your time today. Well, what an exciting time overseeing the Academy, getting to serve as President during the 75th anniversary. As you take a look back, what are some of your highlights from these past 2 years?
Well, the past 2 years have certainly been challenging due to the pandemic. In many ways, the AAN has excelled and is far more robust for it. But our membership has grown to over 40,000 members, and our retention rate for U.S. neurologists has risen to 95%. Our educational offerings expanded even further into the digital space, with a robust online learning platform, prep courses, conferences, webinars, a great question of the day for the mobile app, monthly self-assessments, and quick learning videos and podcasts. The Medical Economics and Practice Committee created resource toolkits for managing staffing and other challenges and improving practice efficiencies, and a library of telehealth practice guides, case studies, coding guidances, and resources were also created. The AAN provided policymakers with critical recommendations that have allowed patients to use telehealth to maintain access to neurologic care and to ensure that patients did not lose access upon the termination of the public health emergency declaration. This past year, we were excited to return to in-person meetings, especially hosting everyone here in Boston, and we're happy to be able to offer the meeting in person and virtually, allowing our members from around the world to join us and get access to all the education.
And what have been some of your proudest accomplishments?
First, let me recognize Dr. Sandra Olson, who was the first woman president and led this organization between 2003 to 2005. But now, times are changing, and thanks to my predecessors who invited women like me to chair committees at this organization and provided other opportunities for women neurologists, we are going to have more women presidents for at least another 4 years. And I'm proud that the AAN has broken that glass ceiling. When I first became editor of Brain and Life magazine, our patient and caregiver magazine, I added brain health so that people could understand the importance of preventive neurology and people living with neurologic conditions could read about the ways to live their best lives. Later, when I became president, I led the board of directors in a conversation about brain health and suggested that the AAN was the right organization to act as a convener and bring together the various stakeholders in the field. A year and a half later, we held our first Brain Health Summit and met with other professional societies, patient organizations, governmental agencies, and legislators to hold a collaborative conversation. When my term began, I established the Committee on Public Education to bring neurology to public attention and continue to work on brain health. My role as a writer has brought me close to our members, and I continue to write for our member publication, Neurology Today, during the pandemic. It was something I had done for more than 20 years. And those conversations allowed me an early understanding, first, of the struggles and needs of our members during a novel situation, and I brought these forth to the board of directors so we could help address them. I'm grateful to those members who contacted me and helped me better understand those concerns, and to this organization for giving me so many opportunities to write about neurologists and neurology and hone that craft.
Dr. Avitzur, again, thank you so much for your time today.
Thank you.
Turning now to the next 2 years, we are joined by President-elect Dr. Carlane Jackson to discuss what's ahead as she takes the helm of AAN. Pleasure to have you with us today.
Thank you. This is such an honor. Really is exciting to be here.
Congratulations on your selection as President-elect. What are you most looking forward to as AAN President over the next 2 years?
Well, I just want to say it's an incredible honor to be selected by my peers in this role. It's really somewhat overwhelming to follow in the footsteps of Orly Avitzur and Jim Stevens and in the history of the organization. So I'm really super excited. There is so much work to do. I can't even begin to tell you all the things that are on our plate for the next 2 years. But, certainly the core mission of the Academy has always been education, science, and advocacy. And we're going to continue to focus on those things. And in the context of our annual meeting, I want to reassure our members that our goal is to try to create that annual meeting experience 365 days a year. So we're really working on some new educational products that will make it easy and fun and simple and convenient to keep up to date with all the changes that are occurring in the field. We're also spending a lot of time focusing on what our role is in this whole world of brain health, what we can do to engage our patients and policymakers in everything possible to create an environment that promotes brain health. And we also, as a profession, are really facing a workforce crisis. We don't have enough neurologists to take care of our patients. And so what can we do as an organization to retain and recruit really motivated people to take care of the vast number of patients that have and face neurologic diseases? We also have an interest in expanding our programs, products, and services to an international market. And so how can we partner with other organizations across the globe to improve neurologic health?
There are multiple priorities that the AAN would like to tackle in the upcoming years. Let's dive into one of those. How do you plan to bolster member engagement?
So certainly just coming to the annual meeting, coming to all our educational programs will engage our members, but there's so many other things members can do. We actually have 800 positions on our committees and subcommittees within the organization where people can get involved. We have a whole array of leadership programs. From people who are in private practice to young faculty who are just starting their career to more senior leaders to women who are leading in neurology. So engaging in those leadership programs is an opportunity. And we have about 40 sections so people can join these online communities and chat and ask questions and converse about topics of interest. But I think most importantly, my goal as president will be to get our members engaged in advocacy. And we've really focused a lot on federal advocacy, but what we're finding is a lot of issues are driven by state policies. And so getting members engaged in local advocacy is really going to be something that we're going to be focusing on.
And when you speak to those in the neurology workforce, which you just referenced, what do you hear are their biggest needs, and how can the AAN offer support?
Yeah, I think there's 3 themes that I'm hearing. One of the silver linings of the COVID pandemic is telehealth. And we found that it's incredibly effective in enhancing the quality of care for patients, particularly in remote areas. So doing whatever we can as an organization to advocate that all the telehealth policies continue to promote that highest level patient-centered care that is our goal. I think the other thing that I mentioned earlier is this workforce crisis. What can we do to retain and recruit neurologists? A lot of neurologists are burning out because of regulatory burdens that can be changed with policies addressing those issues. So things like prior authorization and all of the compensation for evaluation and management codes. How do we get visas for international medical students who want to come to the States to practice? Those are all things that I think we can continue to drill down and work on.
What are you most excited about this year's meeting in Boston, and what do you hope attendees will take home with them?
It's hard not to get excited when we have over 200 educational programs, 2,000 scientific abstracts, really wonderful science in our plenary sessions. I think I'm most excited probably to celebrate our 75th anniversary. I love to dance, so the opening party at the Museum of Science will hopefully be one of the highlights of the experience. We're going to actually start kind of a cocktail hour at the end of every day where we have our plenary sessions. This is the first time we've gotten together in many years without a mask. And so to just be able to have a conversation with someone and see their face will be a highlight. So yeah, lots to look forward to. I'm also really excited. We're meeting with a lot of leaders from other neurologic organizations. And so I'm excited to sit down with them and talk about how we can collaborate on things like brain health.
Dr. Carlane Jackson, President-elect, and someone you can find on the dance floor. Thanks so much again for your time today. Best of luck in these next 2 years.
Thank you. Appreciate it.
Focusing now on our first institution spotlight. Indiana University is at the forefront of Alzheimer's disease research. It's the home of several major national research initiatives, including the Longitudinal Early Onset Alzheimer's Disease, or LEAD study. Let's see how they are breaking new ground in the fight against early onset Alzheimer's.
At Indiana University School of Medicine, we have a strong focus on Alzheimer's disease. But as with many institutions, our focus is on late onset Alzheimer's disease, and we recognize that there was a paucity of studies focused on early onset Alzheimer's disease.
4 or 5 years ago, we realized that there is a chunk of the Alzheimer's disease population that is not studied anywhere, not in observational, not in clinical trials. And that was the early onset population that is unfortunate enough to get this disease earlier than age 65.
It is so critical for us as a community to understand early onset and the causes of it, because it is a group that has been understudied for decades.
We're hoping that the biggest impact for LEADS is that we will have a better understanding of early Alzheimer's and how it presents, how it progresses over time, and eventually the hope is that it will help us design clinical interventions.
For 75 years, the AAN has promoted the highest quality patient-centered neurologic care and enhanced member career satisfaction. So who better to welcome us to this year's anniversary meeting than AAN CEO Mary Post.
On behalf of the American Academy of Neurology, it is my great pleasure to welcome you to the AAN's annual meeting as we celebrate our 75th anniversary. We are honored to have you all here today in Boston, and a special welcome to our attendees who are joining us virtually from around the world. This year's meeting promises to be one of the most exciting yet. We have thousands of scientific sessions and presentations on the latest advances in neurologic research from around the world. But it's not just about the top-rated education and science offerings. We hope this meeting will provide a chance for you to connect and build meaningful networks and relationships with your fellow colleagues and peers. We understand the importance of fostering strong, supportive community, and we hope this meeting will do that just for you. As leaders in the field of neurology, your attendance and contributions to this meeting are invaluable. Your dedication and commitment to advancing the study and treatment of neurologic disorders have a profound impact on the patients around the world. The insights and the perspectives that you bring to the table are shaping the field of neurology. I would like to extend a special thank you to our sponsors who have made this event possible. I would also like to express my sincere gratitude to the organizing committee, the session chairs, and all the member and volunteers and staff who have worked tirelessly for this event and its success. Now we officially open the doors of the American Academy of Neurology's annual meeting. We hope you have an enriching experience and take away valuable knowledge and connections that will help you advance your practice and career. Enjoy the meeting.
Allina Healthcare in Minnesota is a comprehensive nonprofit neurological institute that brings together specialists to take care of patients with neurological disorders. Let's examine their cutting-edge care for stroke, brain aneurysm, and brain tumor patients.
Allina Health is a large nonprofit health system that serves the communities here in Minnesota and western Wisconsin. Allina Health Neuroscience Institute is part of Allina Health, and within the institute we have over 75 neurologists, we have over 35 neuroradiologists, over 10 interventional neurospecialists. So it's a large health system, and we're a comprehensive neurological institute that resides within it.
At our metro sites, we have been able to achieve a door-to-drug time of less than 60 minutes in approximately 90% of our patients. Also, our metro sites have been recognized by the American Heart Association Get With The Guideline program with Gold Plus awards for Advanced Therapy and Stroke Honor Roll Plus Elite.
As chair of the Department of Medicine at Brooke Army Medical Center, Dr. Jeffrey McLean oversees the largest clinical department in the largest hospital in the Department of Defense healthcare system. He also makes time to hold many positions within AAN leadership, and he's also made time to join us today here in the studio. Thanks for your time.
Oh, thanks for having me.
Let's get started with why you feel it's important to hold those positions within AAN.
Well, it's been a real privilege for me to be part of leadership within the Academy. I started as a member of one of the leadership programs where I really started to learn about what the Academy does, what its mission is, and how dedicated it is to really promoting the highest quality neurologic care for our patients and member career satisfaction for all of our members. And so as I got to learn about it, I wanted to be part of that and have had great opportunities to really grow and participate and really have an opportunity to impact neurology across the board.
How would you say that being an active participant in some of these leadership programs have impacted not only your professional life, but also maybe personal life as well?
Sure. You know, one of the things that's been really great for me that I took from my early participation in one of the leadership development programs was really a different way of looking about how I relate to people and thinking about what my personality brings to the table, what other people's personalities bring to the table, and why sometimes you don't immediately click with someone or may have challenges with certain kinds of people. And instead of it just being a problem that stops you, okay, how can you alter how you relate to people? And that helps both professionally and personally at times. And so that's been one of the things that's helped me a lot throughout my career.
Absolutely. Certainly you can take that into your personal life.
Exactly.
Like I said, you've held a number of leadership positions within AAN. Is there anyone in particular that stands out to you as far as helping you achieve, maybe something that you were going after professionally?
Sure. For me, really being involved with the leadership development programs and how we've been able to grow those programs to offer programs to meet people at different stages in their career, being part of that has been something that then I've been able to take back to my department and my career, sort of my day job, and look at how I can help develop people and that I work with day to day.
And you have had a very incredible career.
Thank you.
How has the AAN helped and supported you as you've gone through the different phases of your career?
Sure. So I think really two things that I would comment on. One is just the skill set of how to approach leadership and interact with people, as I mentioned before. That's been incredibly important. And the second thing is just the people I've met, people that have been mentors to me, leaders within the Academy who've been willing to take the time to mentor me as I've grown, who've done the things that I want to do, as well as colleagues that are in the same stage of career, facing the same challenges that I can call on the phone, say, hey, how are you dealing with this? How are you handling that? And then also just the AAN staff who have been amazing and supportive of me throughout my career. That network of individuals has just been something that is impossible to describe how important it has been as I've moved through my career.
Last question for you here. What would your advice be to someone who might be kind of toying with the idea of getting involved within AAN leadership, or somebody who just, might want to get involved with the Academy as a whole?
Well, what I would say is, and you've heard me say it multiple times, leadership development programs. Our array of programs that we've developed over these years has been truly amazing. Going from an early career leadership program to now offering a suite of programs across the career span, programs for people in different career settings, programs for just about everyone. There is a program for you, and now we're opening up with Leadership University, which is really meant to make this available to anyone at any time and where they really need the leadership development. So look at the vast offerings that the AAN has for leadership development. There's something for anyone, and that'll help get you started on the path.
Just do it.
Just do it.
All right, Dr. Jeffrey McLean, thank you so much. It was a pleasure to have you.
Oh, it's great. Thank you.
Certainly a lot of excitement as we head into this week and celebrate 75 years of the accomplishments and achievements of the AAN. There is still much more to come this week as we dive into emerging science, the future of neurology, and AAN's advocacy efforts. But if you missed any part of today's episode, you can always catch up by finding AAN-TV airing on the TV station throughout the Convention Center, on the AAN website, on the in-house channels at all of our partner hotels, and on the AAN YouTube and Twitter channels. Thanks for spending this first day with us. We can't wait to see you right back here tomorrow. Go have a great one.